Hi, I'm Helen Lambert. This learning resource has been developed by myself in collaboration with Social Care Wales, Health Education and Improvement Wales and Improvement Cymru. In the resource, we share some simple, practical advice to support people with dementia the best way we can in such difficult circumstances. None of this is new information. It's bringing together some widely agreed principles that might help whilst recognising that everyone is different. No two people with dementia will experience it in the same way. So this resource is not prescriptive, more informative. The emphasis is firmly on the difference your interactions make in the care and support of people with dementia. If you learn something new, that's great. If you realise that you already know this stuff, that's good too. And if you're new to dementia care, it may just help you realise that you do have transferable skills. If all it does is give you a bit of confidence, that's valuable too. We're all in it together and doing our best to make a difference in such unprecedented times. Most of us will have been taught to explain everything that we're doing, and for many people that helps. However, as dementia progresses, communication will change, even in the early stages. People might struggle to understand the spoken word and will rely more on your non-verbal communication. Important messages can get lost amongst the chitter-chatter. So talk less, be clear, and use your words wisely. As words become less important, how we say things and what we do becomes more important. So show the person that you care through your smile and open body posture. However, if you're using PPE at the moment, some of your facial expressions will be masked. How you say things will become even more important. People will hear your friendliness in the tone of your voice. People will see your actions. So be mindful about what you do and how you do it. Where possible, take your time when interacting with the person with dementia. We need to recognise that some days are tough and the person you're supporting might be finding it difficult to understand the current situation. They might be scared, they might be frightened. So being overly happy and jolly all the time might not actually be helpful. Think about a time where you've been feeling emotional, maybe angry, sad or stressed. Does it help you when someone you know is happy and smiley all of the time? How does that make you feel? We need to validate the person's emotion, to recognise that they're angry, that they might be sad, they might be stressed, and acknowledge that without making things, trying to make everything better. Show that you understand through your body language and tone of voice. Get into the habit of introducing yourself every time you engage with a person. And use the person's preferred name. Mr. Knight, James, Jim, Sir. Avoid the use of terms of endearment such as sweetheart, darling or love. Don't assume it's okay. Have you ever been somewhere, perhaps a supermarket, and someone you don't know uses a term of endearment? How does it make you feel? Not everyone will like it. And never treat people with dementia like children by using terms such as good boy or good girl. Think about your positioning. We don't want to tower over people or get into their personal space. So get down to their level in their line of sight. With current guidance around social distancing, we may need to call the person's name to get their attention, or gesture to them, or you say hello, just to get their attention. Remember to introduce yourself. Your current work role may involve you getting much closer, getting hands-on. So if you're going to do that, make sure that the person acknowledges that you are there before you move into their personal space. Be nice, be kind, be human. Have a chat before you go on to do what needs to be done. Take time with the person. Exaggerate your non-verbal communication to support your words. Your gestures are going to be even more important if your face is hidden by a mask. Give people real choices by showing them the actual object rather than only saying the word. For example, if you want to know if somebody wants a cup of tea, show them the cup of tea. Have you ever been to a foreign country and had to order from a menu? What do? Do you look to see what other people are eating and point? It's actually quite helpful if we can point and say that one to make a choice. Perhaps in that restaurant you look at a picture. How would you feel if neither of these were an option for you? How would you make a choice? So if we can't show the object, can we show a picture at least? For your information, there's a range of accessible information around COVID-19 and how best to support people's choices and decisions in this time available online. Double check that the person has understood what you're planning to do before you do it. Ask yourself how you've explained to the person what it is you need to do. Do they understand you? It's important that we get the person's consent before we start to do things. Sometimes we underestimate the complexity of what we're asking of a person because we understand what a task involves. It can be helpful for some people with dementia to break activities down step by step and to do the first thing first. So if I were to ask you to have a wash, you would know what to do in what order. You wouldn't even need to think about it, you'd just do it. For someone with dementia, they might need that step-by-step help. So the instruction, Les, it's about time to have a wash, needs to be broken down into small steps so that Les will be able to understand and follow right from the start. So in this case, asking Les to lean forward first to get ready to stand, to then get ready to walk to the bathroom, is our first step. You can then show him what to do next using your non-verbal communication skills, showing him the flannel, demonstrating how to wash his face, and he might well be able to copy you. Ask yourself which you'd prefer, someone washing you or helping you to wash yourself. By providing that step-by-step instruction, we help a person with dementia to do as much for themselves as they're able to. So we've talked a bit about the importance of non-verbal communication. Of course, we will still use words supported by that non-verbal communication, but I reiterate, use those words wisely. Think about what you're trying to say and think about the best way to say it. Keep it clear. Try not to put people on the spot by asking them questions that they're unable to answer. Try to avoid questions beginning with a who, a when, or a what. Instead, try and give people the clues. Think about the current situation. Perhaps someone is in hospital and they're not sure why. Rather than a conversation starting with, do you know where you are? Which requires a yes or a no answer. Or a why are you here? Perhaps that person doesn't know. What are your symptoms? When maybe the person doesn't realise what is wrong. Try and give clues and prompts. So for this example, we're going to encourage someone to tell us about it. So maybe we could say, hi Joan, you're in hospital. You got a nasty cough. I'm here to help. Tell me about how you feel. Listen very carefully to what the person is telling you, the words they use, and also look at their non-verbal communication. And importantly, think about the emotion behind the words that they are using. When you listen carefully, you may get a sense of what the person is trying to say through picking up on a few key words. Repeat those key words back to check you're getting it right. John, you're talking about the dog, emphasising the word dog. If someone is getting frustrated, acknowledge that it's hard. Sometimes people will talk around a word they're missing and describe it. They might tell you that it's something that you wear on your wrist that tells the time. If you know what it is, you can tell them the word. You want your watch, maybe tapping on your wrist at the same time. When people are struggling to find the words, they may not be able to express themselves fluently and may actually make their feelings known by swearing. Try not to be shocked or offended, and remember it's not personal. Just let it be. Otherwise you and the person will get even more stressed, which won't be good for either of you. You may want to acknowledge the emotion. You're feeling angry, you're scared, but it's not time to start telling people off for swearing. Another important fact about dementia. People with dementia will experience a whole host of different symptoms depending on the type of dementia, how their dementia is progressing, and their personality. Most of us will know about memory impairment associated with dementia, but another symptom that has a massive impact on the person is often overlooked is vision change. Because of the change in visual field, what the person can see is limited. They'll not be seeing the whole picture. So the person with dementia may not see what you want them to see. So when you approach the person, make sure that you're in front of them and slightly to the side. Make sure that they can hear you well, that they're wearing hearing aids, etc., and that they can see you and respond to you. Try to make sure that you don't suddenly appear in front of the person with vision changes, as it might be frightening for them. The vision change might make it even harder for the person with dementia to see what you're doing and what you're trying to communicate, particularly if some of that is hidden behind a mask. So we're back to how we say things. In the same way that someone will know you are being friendly by your tone of voice, they may recognise that you're stressed, tired, frustrated, but don't understand the reason why. So do your best to manage your own emotion. If you're getting frustrated, and it's safe to do so, walk away. Maybe swap with another member of staff if you can, and if not, take a few deep breaths and try again. The most important thing right now is that we're patient. Good dementia care does take time. So if things are not going according to plan, think about how you are supporting the person the best you can. So remember to ask yourself, have you greeted the person? How have you communicated with them? Have you thought about your positioning? And if something isn't working, make a change and try again. Emotion is running high for all of us right now, and we're all trying our best to do whatever we can, the best way we can. So thank you. Thank you for your time in watching this video and for everything you're doing to show you care.